to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. We continue with this month's theme of A Hunting We Will Go, and then go to the vet. Today's example is a 9-year-old male-neutered pointer with diffuse swelling of the left thoracic limb between the elbow and toe tip with mild to moderate pain. This began following a walk, and he is 5 out of 5 lame. The swelling is most marked at the level of the carpus, where there is a small open draining tract dorsally, and serosanguinous fluid can be expressed with some bruising around this site. There are known adders, which is a type of snake, in the area. For those of you that are new to CT, I wanted to give you a little bit of background. This is a bone window. This is a soft tissue window, and this is a soft tissue window following the administration of contrast. A bone window is considered a sharp algorithm where there is distinctive margins, and we don't have great distinct margins of soft tissues, but the bone or osseous structures are well defined with a bright structure. In CT, we typically use the term attenuation or density to describe tissues as an analog term to opacity in radiography. For the soft tissue structures, we have, in a soft tissue window, I should say, we have improved distinction of other densities that we don't typically appreciate with the same detail that we have in the bone algorithm. This is the density or attenuation of fat. This would be the soft tissue appearance. Bone has a bit more intensity than we do have in the bone window, and so we lose some of the detail that we would have with respect to the trabecular pattern that we would typically have. And following the administration of contrast, frequently we'll have distinction of the vessels, and should there be things like a mass, we can have distinction of the borders or vasculature associated with a mass. In this case, we see a normal right limb, and the left limb is disparate in size. So the left limb is much larger. The musculature that is normal on the right side through here is still well defined on the left side. However, we have this kind of halo of tissue that has relative hyperattenuation, meaning it's more attenuating than the fat, but it's less attenuating than the muscle. And that is present both pre-contrast and post-contrast. And as I scroll through the transverse plane, as we scroll up and down the limb, we identify that that change is not specific to a structure, but throughout the length of the limb. And this is at the level of the carpus. So we see the cuboidal bones of the carpus. And as we continue distally, we're getting into the bones of the metacarpal bones. Here we can see the tendons of the flexors, some vessels, all the way down to the toe tips. And again, as we had noted further proximally in the limb, we have hyperattenuation and expansion of the volume of the transverse area, cross-sectional area of the limb by tissue that is hypoattenuating to muscle, but hyperattenuating to fat. And what that suggests is that there is an influx of fluid, and fluid falls into that category, similar to what you would have in a radiograph, where it is soft tissue opacity, so more opaque than fat, but similar in opacity to soft tissue, this CT gives us greater distinction along the scale of densities and attenuation, that fluid can actually be separated in terms of its attenuation from the adjacent soft tissues. And here, as we get closer to the carpus, what we appreciate is that there is some irregularity of that dorsal boundary, which would be consistent with the lesion that was described in physical exam. And so this patient has severe diffuse subcutaneous edema or cellulitis of the left thoracic limb. A clear cause for the extensive subcutaneous edema or cellulitis is not determined. However, multiple pathologies such as septic arthritis, penetrating wound, neoplasm, or thrombosis such as clot have been excluded. Given the described small carpal wound and the known potential exposure to adders, envenomation by a snake is considered the likely etiology. Be sure to view the full report associated with this case, as there are other minor findings identified in this patient. Thanks for listening, and remember, it's your case, so please post your questions on social media.